Welcome to The Explainer. Today, we're tackling a topic that carries, honestly, an immense amount of emotional weight, as well as some really deep scientific curiosity. We're talking about ovarian, PRP, and rejuvenation. For many folks navigating the incredibly challenging journey of fertility, time often feels like the biggest, most unfair obstacle in the room. So we're going to unpack the medical reality behind a treatment that's currently generating a lot of hopeful headlines. We'll look at exactly what the science says right now, using clear data to really separate the hope from the hype.
Which brings us right to the big question so many couples are asking. Is there a way to turn back the biological clock? It's a powerful, deeply human thought. When you're facing age-related fertility struggles, the desire to find a medical solution to conceive using your own eggs is profound. But between that emotional desire and the medical reality, what is actually possible? Here's our roadmap for today. We'll start with the biological clock, explore what ovarian PRP actually is, and discuss who makes an ideal candidate. Finally, we'll dive into what the data says and set some real expectations. I promise, we'll objectively cover the exact medical details and data you need to know.
All right, let's jump right into Section 1, the biological clock, understanding age-related decline.
As Dr. Christos Roukidis, a fertility specialist whose insights we're heavily relying on today, points out, female age really remains the single most significant roadblock in assisted reproduction. And the biological reality? It's pretty stark. Imagine this. Out of roughly 1,000 eggs recruited during each ovulation cycle, only one, literally just one, is actually selected. The rest are naturally reabsorbed and lost. Over the roughly 500 ovulations in a woman's lifetime, this relentless biology leads to a really rapid, unavoidable decline in egg quality.
But it's not just a numbers game, is it? Women face this double hit of age, a drop in quantity and a drop in quality. As oocytes age, they get significantly more prone to errors in DNA synthesis. This leads to increased aneuploidy rates, which basically just means embryos that don't have the proper amount of chromosomes. And on top of that, the body's immune system expression actually alters as you get older, which can create a much less hospitable environment for pregnancy.
So the crucial point is weighing your options when dealing with these biological realities. Currently, the medical gold standard for advanced maternal age is egg donation, right? It boasts an incredibly high success rate, around 80% after 3 transfers. But egg donation carries complex psychological, financial, and sometimes even legal barriers. And that is exactly why ovarian PRP has emerged as such a compelling alternative. It allows a woman to use her own eggs and is generally a lot cheaper. The catch? It remains highly experimental, with significantly lower success rates.
Moving on to Section 2. What is ovarian PRP? The science behind the hope. Before we look at those success rates, let's break down exactly what this emerging, accessible alternative actually is. PRP stands for platelet-rich plasma. It's a concentrated volume of plasma derived from your very own blood. Now, what's really wild is the sheer density of healing power we're talking about here. These platelets are packed with over 15,000 proteins and tissue-healing growth factors. Think of them as tiny, highly concentrated healing delivery packages that your body already uses to repair tissue elsewhere, like when you get a cut on your arm.
So how do we get those little delivery packages right into the ovaries? Well, here's what the clinical procedure actually looks like. It's relatively simple, very similar to a standard egg retrieval. Step 1, the doctor draws your blood. Step 2, that blood is placed in a centrifuge, spinning it super fast to separate and concentrate those platelets. And Step 3, using ultrasound to guide them, they inject that platelet-rich plasma directly into the ovaries. Now, what's supposed to happen once it's in there? The biological theory suggests these concentrated growth factors might essentially wake up the ovaries. The idea is that it activates existing stem cells, promotes the recruitment of dormant follicles that were basically just asleep, boosts local blood flow to the area, and provides vital nutrients straight to the eggs. It is essentially a biological jumpstart.
All right, Section 3. Who is a candidate? Identifying the right patient.
If this can potentially jumpstart the ovaries, who is this experimental treatment actually designed for? When evaluating medical profiles, ideal candidates generally include women with low ovarian reserve, folks who haven't responded well to standard IVF, women with premature ovarian failure under the age of 40, and those in perimenopause. On the flip side, based on pilot studies like the one at IVF Life, there are some clear exclusions. Women with severe obesity, poor ovarian access, a history of cancer, or those who chronically use anticoagulants are generally not candidates for this procedure.
Which brings us to Section 4. What the data says, evaluating the clinical evidence.
We are now going to strip away the biological theory and look strictly at the numbers from recent clinical trials. A major Turkish study followed 510 women diagnosed with poor ovarian reserve who underwent PRP. After the injection, a vast majority were able to proceed with IVF and actually generate embryos, which is amazing. But the critical number is that only 11.4% achieved a live birth. While that definitely offers a genuine ray of hope, we've got to objectively acknowledge that nearly 89% still did not achieve a live birth even after the treatment.
Another controlled study reveals an even more complex reality. In a group of women, mostly over 40, those receiving PRP showed an impressive 26% clinical pregnancy rate compared to just 5% in the control group. They also saw temporary bumps in AMH, or anti-Müllerian hormone, a key marker of ovarian reserve. But here is the stark medical reality check. At the end of the day, there was absolutely zero difference in actual live birth rates between the two groups. Miscarriages still occurred at the exact same rate.
Which brings us to this absolutely crucial medical caveat. Right now, there is no standard protocol for PRP. You're going to see wildly different results online and across clinics because they are using vastly different techniques, different platelet concentrations, and different injection timelines. It is fundamentally an experimental therapy, and the science just hasn't settled on a universal best practice yet.
Okay, final section. Section 5. Real expectations for patients. The grounded reality.
Let's synthesize all this clinical data into practical, realistic takeaways for anyone researching this path today. First, you really have to understand the waiting game. If you get a PRP injection on day 0, you shouldn't expect magic tomorrow. The absolute earliest signs of follicle growth might appear at 4 to 6 weeks. Standard biology dictates it takes about 3 months for a natural egg recruitment cycle. Most often, doctors report seeing the actual positive results of a PRP injection around 6 to 7 months later. It requires immense patience in a process where time already feels so short.
Let's hit some rapid-fire clinical realities based on our sources. Number 1, PRP primarily improves the quantity of eggs, not necessarily the quality. Number 2, it absolutely cannot change an embryo's chromosomes or fix age-related genetic abnormalities. Number 3, can you conceive naturally post-PRP? Yes, it's definitely possible and has been documented. However, finally, for patients over the age of 50, specialists still strongly recommend considering egg donation rather than PRP.
I want to wrap up this explainer with a profound, empathetic, and honestly deeply grounded quote from Dr. Christos Rokodis. He says, "It's particularly important to empathize that with or without PRP, we still have a very low probability of success. The method still remains experimental." It's so vital to weigh the immense hope of these emerging treatments against grounded medical realities. Does the potential reward of PRP outweigh the experimental nature for you and your personal journey? That is the ultimate question to take to your doctor. Thank you so much for diving into this incredibly complex topic with me, and keep learning.